Okay. Yep. Okay. I hope you can all see monitoring and evaluation webinar 7. Okay, so good afternoon, everybody. 7th in the 8-part series, so just one more to go, and we're now at the top of the stack, thankfully. So we're looking at the continual optimization of eHealth services in this one, and really this is the monitoring and evaluation theme. And what I want to talk through with you is, first of all, to consider the issue of health outcomes and eHealth outcomes, then to look at what the toolkit says about monitoring and evaluation, and in particular what it says about eHealth outcome and output indicators and eHealth outcomes, and then to look at the monitoring and evaluation tools and standards that are available to be used, particularly in terms of IT governance, and then Six Sigma and ITIL in their continual service improvement module. And to look then at the second part of the question about IT governance, which is to do with risk management. And there are standards from ISO and COVID to look at there. And then, as before, I'll suggest some possible capacity building resources for you to review and select from. So I hope that's going to be a useful hour and a half of our time, and a good resource for you to draw on later on when you come to need this knowledge for real and in detail. So you remember in the first webinar series, I talked about the triple AeHIN approach as being a very powerful and increasingly widely used framework for assessing and guiding the development and direction of health services, because the intention is to address the issues around population health, the experience that individuals have of care, and managing the per capita cost simultaneously. And the initiatives in this area have been going on, and they are also obviously and rightly concerned with the measurement of the outcomes. And you'll see here that for population health, there are outcomes being suggested in terms of the health outcomes and disease burden and behavioural and physiological factors. And in terms of experience of care, there are outcome measures that can be made from surveys or various other key dimensions, such as the Institute of Medicine's aims for improvement. And then there are outcomes that can be measured in terms of total cost and usage. So these are outcomes, health outcomes, disease burden outcomes, behavioural, physiological factor outcomes, etc., that reflect how the health service was used. They do not say anything explicitly about the use of ICT. And this is the difference between thinking about health outcomes and what the health system as a whole is trying to do and how effective it is in delivering it, and the contribution of ICT in enabling that to happen. All right? So those are health outcomes. And then if we think about eHealth, there was an important piece of work that was commissioned by the World Health Organization that came out of the Bellagio conference in 2008. I've given you the URL there so you can follow it up. But Richard Scott and Aida Saeed gave quite a thoughtful assessment of the characteristics that we should be aiming for in developing eHealth indicators. So you'll see here that they're suggesting we should measure the impact of eHealth or ICT-based solutions to support decision policymakers in enhancing, through eHealth. This is the important bit for us. What impact is eHealth making in monitoring progress and improving and maintaining health of individuals, communities and populations, and the functioning of the health system for which they are responsible? So there needs to be a relationship between the eHealth indicators and the health goals that the health system is trying to achieve. And ideally, these ought to be based on standard definitions and methods and be readily available. Now, I think there's a huge amount of work to be done actually in this area. To my knowledge, there's been no standard approach to defining eHealth outcomes. That there seems to be work going on within individual countries to come up with assessments of the impact of eHealth, but there's no significant body of literature that is actually assembling any consensus about eHealth outcomes. So although the requirement has been clearly stated, I think the actual delivery of eHealth outcomes and ways to measure it has not been. And I think this is an area of work that is important. And I'm sorry that it's not well developed, because it means that each of you may struggle to come up with some sensible ways of measuring and assessing eHealth in your particular country. But again, an area where keeping in close touch with your peers working on the same problems within other countries is probably a very sensible thing to do. Anyway, so that's just a word or two about the difference between health outcomes and eHealth indicators and outcomes. So the strategy, the toolkit, the WHO ITU eHealth Toolkit in part 2, which is concerned with the development of action plans, has this little table which we've seen before. And I'll just flag up that in this session here, what we're talking about are the ways in which, through monitoring and evaluation, in fact, health systems can change and adapt and adopt new practices. But the monitoring and evaluation is really the focus of part 3 of the toolkit. The action plans is part 2, establishing the vision part 1. But today we're focusing primarily on part 3. And in part 3, there's a summary diagram that says, well, you need to have indicators, measures, and governance. And the indicators are to do with the eHealth output indicators, which measure adoption and take-up. eHealth outcome indicators, measuring the results for stakeholders that arise from the adoption and use of eHealth. And I'll come back to both of these things in a bit more detail in just a minute. But then also it's important to have the governance processes for monitoring and evaluating the adoption of eHealth. And the definition of a governance model for national monitoring and evaluation is addressed in part 3 of the toolkit. And I think the point I just wanted to make here was that usually the national monitoring and evaluation of eHealth and health systems is done separately from program management. And in a way, this is why the toolkit makes the distinction that I discussed on Friday between the program management activities and the monitoring and evaluation. So very often countries will have a separate monitoring and evaluation unit that looks in a more independent way at progress that's been made. So typically you'll find subject matter experts, third-party organisations, NGOs, who've got the expertise in monitoring and analysing and evaluating the results of eHealth. And of course there are external and international agencies that can look at and provide support in some of the areas around research. Now, the thing is, when you engage people who've got expertise in this area, they will inevitably and rightly have a set of requirements for the indicators and the measures that they're going to need in order to make their assessments as to how the delivery of eHealth services is progressing. So they will be wanting measures of eHealth outputs and eHealth outcomes. Now, I'm illustrating here that in a sense, the consumer stakeholder perspective, and in fact, in the rest of the webinar, it's worth just making a distinction in your mind, just hold in your mind that there is quite an important difference between consumers who are essentially citizens and patients and the users of the health service from those who are, in a sense, the internal customers of the delivery of IT. And again, I'll come back to that distinction a little bit more later on. So if we take as an example from the point of view of consumers who are the citizens and communities, the sorts of outputs that you'll see there are suggesting, okay, so what have we done to provide measures of adoption and take-up? Remember, this is really what eHealth outputs are about, the adoption and take-up of the services that have been offered, typically by communities. So what's been the take-up of fit-for-purpose data and telecommunications connectivity? Has a national telemedicine service been established? What has the eHealth service, in a sense, made available to communities, and to what extent, from the service deliverers' point of view, has been the adoption and take-up? Have we provided the coverage of service? Now, there's a distinction between that and the outcomes of the use of that service. So this is where what you're trying to do is to get closer to understanding how, for, in this case, consumers, they as individuals have experienced a change in the services that are available. So what we're trying to do here is improve the ability of consumers located in rural and remote locations to be able to access primary care services and reduce the need to travel large distances to access care. So the eHealth outcome might be a percentage increase in the number of primary care consultations conducted by telemedicine. So the outputs are to do with the provision, the supply of services. You've made them available. The outcome is, well, what use was actually made of them by the people you were trying to reach? Okay, so there's a distinction to be drawn there. And as I say, I wish there was more material that I could point you to easily that gave a considered view about how best to handle this. But actually, the toolkit, although it references these issues, doesn't really point you to anything that is really of great practical help. And personally, I think this is a weakness at the moment in the whole work of the eHealth community. I think the measurement of outputs and outcomes needs to be improved quite a lot. But anyway, that's where we are now. The strategy is clear about the, and we've seen this diagram before. This is about saying that it's a continual process of monitoring and evaluation of the implementation of the action plan. And you'll see in there, you know, that there's a you plan to do something, you execute and measure it, you look at the results and you take any corrective actions that are needed and refine it, and then you go on. And I think just the shape of that diagram gives the right visual impression of what it is we're trying to do. It's a continuing cycle of improvement. So that's what very quickly, that's what the eHealth Strategy Toolkit has to offer. Now, you remember that the webinar that we had right at the start was to do with IT governance, and I referenced there, and I'm coming back to it again now, a board briefing paper that was produced by the IT Governance Institute in conjunction with the Information Systems Audit and Control Association, that's ISACA. And this is a good document, and there's a nice little quote in it that's in the middle of the diagram. IT alignment is a journey, not a destination. And I think that, as you'll have seen from the previous slide, there is this sense that the monitoring and evaluation part of any system needs to be understood as a journey, a process, one of learning. But the ISACA briefing makes a very important point, and this point is what I focused on in framing this webinar. So it's saying that IT governance is concerned about two things: IT's delivery of value to the business, on the one hand, and the mitigation of IT risks. So these are two sides of basically the same coin. First, driven by the strategic alignment of IT with the business, and the second driven by embedding accountability into the enterprise. So you have to actually consider both of these two things and the dynamics between them. So, you know, as I've already alluded, alignment is more than just the strategic integration of IT and what the enterprise is trying to do in the longer term. It's also about how well is that aligned with what you're currently doing. And one of the things that is suggested as a very effective way of helping the board or the management of an organisation, whether this is at national, regional or hospital level, to get the right information to make these sorts of judgments is what's called a balanced scorecard, a BSC as it's sometimes abbreviated. So that's what we'll consider in just a moment. So you'll have seen from the diagram that we're trying to get the balance right, and it's a two-way process between the elements of the strategy of the whole organisation, the health outcome or the health outcomes it's trying to achieve, the IT strategy, which is all about delivering eHealth outcomes, and the way in which the operation of the enterprise and of the IT part of the organisation interact with each other, and there's a continuous process of alignment going on. Okay. So balanced scorecards are a way of trying to manage this balance. And I think the important point really is that they deal with relationships and knowledge-based assets that are both quantitative and qualitative. They're kind of balanced scorecards are to try and get around some sense of what the intangibles are. It's saying that you're trying to get a more holistic view about how you can link the long-term strategic objectives with the short-term actions. And to do this, one needs to keep a focus on what the customer wants, to make sure that you've got efficiencies in the way in which you process things in the organisation, operational excellence, and also, and importantly, the ability to learn and grow. So the board briefing suggests that there are 4 points of view, challenges in a sense, that the management of the organisation needs to be continually asking themselves. And they're to do with finance, the customer's perspective, internal processes, and learning. And I think that from my perspective, actually, if I was pushed to say which one of those I think was most important, I'd actually say the learning perspective, because I think that means that you will learn, if you go about it in the right way, pretty soon, whether, for example, you need to pay more attention to your finance side, or to your customer side, or to your internal processes side. So if I was pushed to go for one, I would say that one. But really, you need to be trying to do all 4 simultaneously, at the same time as you're trying to simultaneously hit the 3 aims of the enterprise as well. So some examples then of the balanced scorecard measures. And if we start at the bottom, right at the bottom, you'll see in the technology leadership, it's suggesting develop enterprise architecture. And I hope that immediately rings a bell with you and you remember the enterprise architecture webinar that we had. And then if you look up in terms of the business partnership, it's all about delivering successful IT projects. And the session last time was all about delivery in doing that. So the operational excellence is about performing the IT functions with increasing credibility and impact. So getting the relationships right between the technology and the architecture, the business partnerships and the operational excellence. And that then feeds into the way in which you're actually meeting the expectations of the business, the providers of services and contributors. So what impact is it having on the business processes? And in doing this, you're increasingly looking at things from the customer's point of view. And I'll talk more about this distinction between the user and the internal customer. And I think the flavour of the ISACA approach is rather a reflection of the needs of the internal users of IT services rather than the person in the street. But in principle, either of them are a customer. And then, okay, so what impact does that have on the corporate contribution? How does the management of the organisation deliver effective IT governance? Is it aligning it with its business objectives? Is it delivering value? And from whose point of view would you say it's delivering value? And this process then continues to reflect on the future orientation. And you'll see the bottom bullet point there is talking about capturing knowledge to improve performance. So this is all to do with, in a sense, reflecting on the whole learning process. And in the middle of all of this is information. And obviously it's different sorts of information that are being needed. And you have both hard and soft data and measures and indicators being used. And the point about the balanced scorecard is to try and enable you in a systematic way actually to reflect on what this range of different types of information is actually telling you about how you're doing internally, how well you're meeting the needs of the customers, what needs to be done from a corporate point of view, and if you're aligning with what you had been thinking about was your future direction and which you might want to adapt in the light of experience. So I hope that has given you some understanding about health outcomes, eHealth outcomes, what the strategy has to say on the topic, and then to begin to put that into the context of IT governance and bearing in mind the entirely correct view, from, as I would see it, that IT governance has got concern with the delivery of value to the business on the one hand and the mitigation of risks on the other. So I think at that point, Elia, I will stop and we will have a Q&A and sharing session. So over to you.
All right. Thank you. We already have a lot of questions in line in our Q&A chat box. Let me read it so that we could address it completely and briefly. From Jay Ganesh of India, also one of the AeHIN working councils, is there any criteria for selecting the national experts in terms of skills, competencies, experience, etc.? Because it might be easier for MOH to engage if there is one and help avoid bias or favoritism.
Yes. I think the honest answer is I don't know. So I'm not saying no, there isn't one, but I don't know of one. There may be something available, but I'm not aware of it.
All right, so I think this would be one also of a number of research questions that we are already identifying in our AeHIN Academy, which I believe our network could answer altogether if structured, for a study.
Yes, I agree, Elia. I think that's the right way to proceed. That this is an issue that needs sharing and comparing and the development of a consensus as to what good practice should be and what the sorts of criteria are. Yeah. Very good.
All right. Thank you, and I hope everyone gets excited as I am in terms of this. These questions are popping in our chat box and our Q&A box, because this will really help us identify where we are now, and the questions that are already the questions that are not yet being answered for the last months that we are moving on to the creation of our eHealth strategies. Okay, another question here from Jay Ganesh still. Does the toolkit provide emphasis on documentation of experience or implementation that would provide a basis for evidence in measuring the outcomes?
The toolkit itself doesn't. No, is the short answer to that. It doesn't.
Okay, so I hope, Jay, the answer is complete enough to say that the toolkit doesn't provide, yes, emphasis on documentation. Another question is, if there's a uniform template available to record the eHealth implementation details, it would be easier to monitor and evaluate subsequently. Else there could be the risk of being largely qualitative in terms of evaluation. I think this is a sharing from him. Do you agree on this?
Yeah, it's the same issue. You know, from my understanding, the toolkit doesn't really give the sort of documentation in the sense that we're talking about in this webinar series. It gives the overall policy, but it doesn't get down to the level of, okay, so this is what you can do in practical terms to make this happen. And that remains the case in terms of developing any frameworks as was just being requested. I'm not aware of them. What tends to happen is that, as you're doing with AeHIN, there is a sort of a sharing of issues, and often it goes on kind of informally between peers when they happen to meet at a conference. You know, so when I was the information policy lead in the UK, we had regular meetings between myself and my opposite numbers in Northern Ireland, the Isle of Man, Scotland, Wales, and the Channel Islands, so different parts of the UK. Basically just to share progress and think about the things that we were doing differently and the things that we would like to do in common. And personally, I think there's great value in doing that, but it would be preferable if there were, as a result of those sorts of networks, a consensus that builds and enables the international policy bodies such as WHO to begin to assemble some practical wisdom that's drawn from the field and review and then refine it so that it can be reused, and for these much more kind of practical frameworks of guidance and good practice then to become more widely shared and available, used and continually refined.
All right. Yes, we need synergies to work together, and as a network, this is our power. If AeHIN will work together to identify ways on how to resolve these problems and share experiences, then we could arrive at solutions that would provide us a better answer to our existing problems that are altogether tailor-fit in our current situations. So thank you for the questions, Jay, and I hope others would also pose their questions. From Win Min State of Thailand, just to make myself clear about one thing, what is the difference between output indicator and outcome indicator? Because in both cases, the country need to have measures for indicators of monitoring and evaluation. So is this correct? Please confirm.
Yes, you're right. You do need to have indicators for monitoring and evaluation, but the thing about the outputs is that this is really saying, is what we as a service have been supplying to communities being adopted and taken up? The outcomes is trying to get close to, and what have been the benefits for individuals from the use of eHealth. So that was why I was making the distinction between putting in place the infrastructure in a sense that enables, let's say, telecare or telemedicine services to be provided. So you've got an implementation program that is concerned to make sure that you've got a rollout of mobile broadband or fixed broadband, but you've provided one way or another the infrastructure, and you've provided you've got the right levels of skills for the staff and at the local and the central services. You put all the services so you can measure the output of the work that you've been doing. How successful have you been in supplying the services? Did your delivery program deliver what it said it was going to deliver to this number of places by this time? But that's a separate question from, okay, so how were those services actually used by individuals? And that's the eHealth outcome perspective. And that's why you would, for example, then be looking at, so what was the increase in the number of primary care consultations that were actually conducted via telemedicine? Now, if you were looking at health outcome, that would be to do with did people with an eye problem, for example, have those, was eyesight levels improved? That's the health outcome. The eHealth outcome is to do with, was that to do with the use of ICT-enabled services? So eHealth outcomes is not a clinical measure, but you're trying to demonstrate the benefits of using eHealth to get improvements in the clinical outcomes. So it is a difficult distinction to make, and an important one. And I guess the main point is just to make sure that we always kind of keep clear the difference between what the health service in general is trying to achieve, and it has to throw lots of resources, financial, staff, equipment, etc., of all sorts, and all of that needs to be managed. And the issue for us is, okay, so insofar as we have responsibilities for the ICT components, how do we demonstrate how good and how useful and effective and the value for money that we're actually able to provide? So that's why I think it is important that there is a growing body of good practice that emerges to help describe the impact that eHealth has.
Okay, I think would it be safe to say that outputs are what we have as services to communities, while outcomes are results in which we are to resolve the general problems of the health system?
No, well, nearly. I think outputs is, as you were saying, is the services to communities, and the outcomes is the impact on individuals or the users of services. So you're making stuff available to people. That's the output of your work. The outcome is, what impact does that have on the people that actually use it? That's the outcome.
All right. I hope that we were able to distinguish the difference between outcomes and outputs, because this is very important to managers. All right. We move on to our next question. How do we capture knowledge?
That's the one, I think. We'll make this the last one, and then keep the rest for the next Q&A.
Okay, so we keep our last 4 questions for the next Q&A. Thank you. We may proceed to our session.
Okay, thanks, Leah. Right, sorry to cut it off there, but we do still have quite a lot to get through. Okay, sorry. Let me just, yeah, there we go. Right, so let me now move on to 2 related standards. So there's an ISO standard that describes the methodology for business improvement known as Six Sigma. And it's really Six Sigma that I wanted to focus on. And I don't know if you're aware of this, but basically it was a technique developed in the mid-80s, 1980s, at Motorola. And it was to do with manufacturing, and sigma is a statistical measure of deviation from a norm. And basically, if you have 6 sigmas, that means that you have basically got a virtually perfect product. In other words, if you were producing 100 products, 99.99966 of them would be fine. If you only had 1 sigma, that would probably mean you were only producing 30 that were actually fine. So basically, it's an indication of the quality that was trying to be achieved as a result of the manufacturing process. But what became evident was that this was also applicable to service and transaction processes as well as manufacturing. But the more important issue, I think, and this is why I wanted to share this with you, is that Six Sigma was developed really to understand what the service feels like to the person who is receiving it. So basically, it was a technique that Bill Smith and others developed to kind of focus the attention of the ways in which these big manufacturing companies addressed the issues that actually made a difference on what was perceived as being the quality of the outcome that the service users actually received. So, voice of the customer was the phrase that we used, and it did mean exactly that. So it was kind of the driver of the car, or in our terms, the patient in the hospital or the sick person in the community. And having sort of made this big step really to try and make sure that actually understanding what the end consumer's perspective was actually drove the decision making within an organisation in terms of prioritising where it tried to make improvements, they came up with a methodology that basically, and you will not be surprised to know, that was one of a continuous loop of improvement. And so this is an illustration of the high-level view as to how Six Sigma is used. So if you take some of the observable behaviour that's going on at the bottom, it generates lots of facts and data. And one of the acronyms that Six Sigma came up with, but perhaps I should have stressed more, it was on the previous slide, was the DNAIC thing: define, measure, analyse, improve and control. So that was the heart of their methodology: define, measure, analyse, improve and control. So the facts and the data are then looked at from the point of view of defining, measuring, analysing, improving and controlling. Right? And at the same time, they're also looking at trying to identify parts of the business that's most critical and has the best opportunities to improve the quality that is delivered to the customer. So the intention really is to move from what you see going on through these processes to seeing some results and then checking whether the point, what's called the point of pain, i.e. where the challenges are perceived by the consumer, are met or not. And the problems that are shown up there, if they're going to be addressed, need to have some support from the executives. So there's a continual process to try and identify the different parts of the organisation that need to focus on the challenges that the end consumers, the customers, are saying are the things that are causing them pain or problems, right? And then the projects are selected and scoped and funded, and they are delivered by people who've got particular training in quality improvement. And you'll see that that training can come with people who've got black belts or green belts or yellow belts. So these were, in a slightly kind of humorous way, the ways in which the skills that the Six Sigma practitioners actually had. So these, a black belt, for example, would be somebody who's like a full-time person who's trained in quality improvement techniques, and they spend 100% of their time on it. Whereas a green belt person is not typically dedicated full-time to it, but they've had quite a lot of training, although they're not yet as competent as a black belt. And a yellow belt might do it on a much less intense way. So you try and get the right level of training to support the assessed importance of resolving that particular part of the process. And aligned with DMAIC, there was also a define, measure, analyze, and a design step and a verification step. So this is like saying, okay, so we've got a problem here. How we, in manufacturing terms, we need to redesign a steering wheel. So let's do it, have a design, and then we've got to check that it's working well. So there's a separate but related DMADB process to try and figure out a particular way of reconfiguring the organization or the way it produces a product or a service, and then checking. And of course the checking may be in as kind of a simulator as opposed to reality, but one way or another you have to verify that it's going to do what you want, and then drop it into the process and see if it achieves that result. So that's basically the approach to Six Sigma. And I wanted to just make sure that I'd made the point that the real benefit that Six Sigma demonstrated in very impressive performance by the companies that adopted it was that by focusing on what your customer, your real driver of a car or user of a health service actually says are the things that are causing them problems, actually delivers much improved use of the organisation. So that may mean greater sales of cars, or it may mean better use of health services. So people know perhaps when to get the right care at home as opposed to having to go to hospital. Okay, so really Six Sigma focused on the customer. Now, ITIL version 3, you remember last week we looked at the service operation part of ITIL, but you'll see going around the outside of the ITIL logo on the left there is the continual service improvement. And the purpose of the continual service improvement, as it says, is to align the IT services with the changing business needs by identifying and implementing improvements to IT services that support the business processes. Now, in contrast to Six Sigma, ITIL kind of defines the customer as someone who buys goods or services, or kind of the individual that has the checkbook, and they may or may not be the user in the way that Six Sigma defines it. So ITIL is really defining the user as the person who uses the IT service on a day-to-day basis or relies on its product or services. So this is, I think, kind of closer to the IT governance ISACA perspective, where the thinking is largely driven by the requirements that the internal users of products or IT products or services within an organisation will have. But there's no reason why the principles that are being developed by ITIL can actually be adapted for use by those who've got a focus, as Six Sigma practitioners certainly have, on users as real users of the system in the sense of being the end customer. But the process is indicated here. So again, it's the familiar loop of vision. Where are we now? Where do we want to be? How do we get there? Did we get there? How do we keep the momentum going? And there are measures of different sorts that can be made available there. So again, the balanced scorecard framework, I think, is entirely consistent with the way in which ITIL goes about assessing the ways in which services can be continually improved. And in fact, its 7-step improvement process looks like this. And I think one of the things that attracts me to this framework is the fact that in the top left-hand corner of this diagram, you'll see the word wisdom. And I think that's a commodity that is often in short supply. We rather focus on the data and the information and the knowledge in terms of our activities, the other 4 corners, and we don't pay enough attention, it seems to me, to those who've got the wisdom to apply the knowledge in the right way. So that's a kind of a very high-level reason for commending the 7-step improvement process to you. But if you then break it down, as I was just doing on the previous slide, you can look at, trying to work out what the strategy is to improve it, define what you're going to measure, get the data together, process it, analyze it, present it, make the implementations and improve it, and then reflect on what happened. So this is the classic kind of plan, do, check, act cycle going round and round. So I think the ITIL 7-step improvement process is very useful, helpful to have in mind, and a good check that we are thinking about the quite rich mix of issues that need to be thought about simultaneously, but in a structured way. Okay, so reflect on that diagram. Now, as I've been trying to do throughout this webinar series, I've been looking for the ways in which you can understand how the different standards and approaches relate to each other. And that's why I wanted to share this next diagram with you, because in the document that I've been referencing throughout the Six Sigma section, and ITIL, there's also, I haven't mentioned it throughout, but at the bottom of the Six Sigma diagram, there's a good paper by Axelos, Integrating Six Sigma ITIL CSI white paper. And you'll see from there that there is indeed a relationship between the 5 stages of Six Sigma in terms of defining, measuring, analysing, improving control, and the 7-step improvement processes that ITIL are recommending. So I hope that you can reflect on those and use the framework, or encourage your staff or colleagues to use whichever framework seems likely to be of most help for them. Of course, one of the upsides of ITIL is that it's got the other elements that we've already mentioned associated with part of it. But if you need to have a more focused piece of work done that is concerned with the voice of the patient or the voice of the sick person, then you may find that getting some Six Sigma expertise will be of particular benefit and help to you. Okay. So ITIL is certainly a useful framework to have, and so you won't be surprised, there's COBIT. In COBIT 5 and risk helps us deal with the other part of the two sides. So we've looked at the improvement of the business and delivering a better business value, but then you've got to think of the other bit, which is to do with how you manage risk. And COBIT's in its COBIT 5 for risk has two parts to it. One concerns what an enterprise needs to do to establish a risk function, responsible for actually managing, for identifying risks, and then the process of risk management. Having set up your risk function, then how you're going to identify, analyze, and respond to the risks that are delivered. So you'll see in the bottom right of this diagram the risk IT management frameworks, right? And in there, you will see that it's referring to ITIL and ISO 2000, the ISO 27000 series, and in the webinars 2 and 6, we looked at ISO 20000 and we considered and also reflected on ITIL in terms of service management last week. And then in webinar 4, I looked at 27001 in terms of standards for information security management. And on Friday of last week, we looked at the Code of Practice for Information Security, which is 27002. So I'm not going to cover the IT management frameworks now because you've got the material there to unpack and look at. So that's saying how do you actually manage the risks when you've identified it. But then you've got to set up a risk function within the organisation, and that's where there are some additional pieces of guidance and management standards that I wanted to make sure that I had pointed you to. So the first one, as you'll have seen, was COSO, Internal Control Integrated Framework. And this has come from 5 professional accounting associations. That's the sponsoring organisations, and the Treadway Commission is named after the chairman of the organisation that was formed in 1985. And the background for this was that there was great concern about fraudulent financial reporting, bribery and corruption. And this commission was brought together to try and come up with some principles. And over the years since 1985, and what we're looking at now is the May 2013 version of COSO, which has got 17 principles. And these are all really to check that the organisation in question has got the right control environment, risk assessment, control activities, information communication, and monitoring activities in place. All right? And the details of the COSO documentation set out the ways in which the different objectives of organisations, whether that's in terms of operations or reporting or compliance, that's across the top of the cube on the right, are complemented by the components and principles of internal control. So that's control risk, control activities, information communication, monitoring activities in the front of the cube, and that you've got the right requirements for effective organisational structure in terms of, whether you're looking at a whole entity or division or an operating unit or a function. So this framework is really trying to make sure that different levels of the organisation, or the different objectives of delivering operations, reporting and ensuring compliance across the issues of control, risk assessment, information communication monitoring, etc., have got the appropriate risk functions in place. So it's a framework that you can use in quite a detailed way to work through and think through whether you've got the right level of expertise available. So COSO is a contributory set of guidance, and you can see where it played into the COVID framework. So if you want more in this particular aspect, you know where to go to. And then ISO 31000 on risk management. It's just to sort of provide the reference to it really, but it's providing just generic guidelines on risk management again. It's not intended for certification. It can be used by any organisation, not specific to any industry or sector, and focuses on risk assessment concepts, processes, and the selection of risk assessment techniques. So if you want to check you've got some ISO standard compliant approach, then that's the particular one to go to for risk management. And then in terms of the security techniques for information security risk management, ISO IEC 27005, which I think was first produced in the 2008 was the first edition. So 2011 is the latest edition. And this is quite clear that in terms of risks, what you need to be looking at are the information assets, the threats and the threat sources, the vulnerability and the potential consequences of impact if the risks materialise. And I think I'd also draw your attention to the second part of the second bullet. Merely having certain vulnerabilities does not necessarily mean an organisation faces unacceptable risks if the corresponding threats or business impacts are negligible. So basically, ISO IEC 27005 is providing, another framework that is saying, make sure that you have thought through all the different types of assets that you have, and all the different threats and threat sources, and all the potential vulnerabilities and potential consequences if risks materialise. But understand that you may be very vulnerable, but does it matter if the threats or the business impacts are negligible? No, it probably doesn't. But the discipline of going through and making those assessments is what's of value. And the first part of that middle paragraph is also an interesting one, in that they're basically saying, take care, beware of using any kind of automated system to make your risk assessments for you. This does require human judgment to understand how these things work in reality or not. So just take care and be sensible as to how you go about doing it. And again, and I think this ties in with a lot of what I've been saying this morning, it deliberately remains agnostic about whether you're using quantitative or qualitative risk assessment methods. Basically use the right tool that is appropriate for the job, and that's the important thing. So choose what suits you to help you estimate the risks. All right? So I hope that's just a very quick skim through some supporting pieces of guidance that you may find of help to you. And then I wanted to end with looking at the COVID risk function perspective, because as last Friday when we were using COVID as a framework, you'll see that the different processes that it has within it are of differential relevance to, in this context, risk management. So here, the ones that are particularly relevant to the risk function, setting up the risk function, are the ones in dark pink. The supporting ones are in light pink, and then there are some that are not so relevant. And also remember that COVID distinguishes between the processes for the governance of enterprise IT and the management of it. So the governance bits that are relevant to the risk function are 3, EDM01, EDM02, evaluate, direct and monitor, and EDM05, ensuring stakeholder transparency. And then in terms of monitoring, evaluating and assessing, which is in a sense the flavour of what we've been focused on in this webinar today, you've got MEA, 01, 02 and 03. They're all relevant to the risk function. So again, if you look at the COVID documentation on risk, you'll see that there's a lot of guidance that's now available. You can follow up within that COVID documentation what will be particularly relevant. So I've been focusing just on the risk function, but there is so much more within that framework, and the framework does draw on other frameworks, and I've teased out for you just now some of the relevant supplementary guidance that's available on the risk management standards to support the risk function. Okay, so we did the IT management frameworks over the previous webinar sessions, but enterprise risk management standards are the ones that I covered just now in terms of COSO, ISO 3100 and 27005. So again, just so that you know that these things exist, you've got some initial points of contact with them that you can follow up if and when you need to. So I think that's got us pretty much on time to where I wanted to get to for the next and last Q&A and sharing session. And I know you've got some questions lined up already, Aliyah, so over to you now.
Okay, thank you for this. We start now with our question from India, from Jay Ganesh. How do we encourage sharing of knowledge or evidence for not so successful outcomes?
Oh, very good question. Very good question. There is such a huge amount that can be learned from things that fail. A huge amount. And of course, people are often quite reticent about sharing things that have failed. And really, that's a pity, but it's entirely understandable. I think one of the important things is there to be, in a sense, a safe space for people to share knowledge of things that have failed. And again, that safe space or safety comes from either having it anonymized, but then often it can be, in a sense, deconstructed so that you can actually figure out where the failure comes from, or it's shared with peers, your peers on a face-to-face basis, or indirectly, but with people that you know, because everybody has failures, and I think that again, AeHIN has a great possible function in promoting good practice. But I think equally, you've got a good potential role in learning from failure. And I think that if people feel that it's a safe space, a non-judgmental space, and that failures are there to be learned from collectively, then that is to be very much encouraged. I hope that's helpful. It is a very good question to be raising in my view, and I think as a community, as an eHealth community, we should be finding better ways of learning from failures, as we should indeed from learning from successes. So, yeah, thank you for that.
Okay, so the most important thing I got from that answer is to provide a very safe space for people to throw out or to share their experiences. So thank you so much for that question. I think that really works in a community where there is trust and real friendship, such as AeHIN, because we are not here to share about success stories only, but also stories that doesn't work, so that we will all be guided to use our resources more efficiently. Thank you so much for that question. We move on to our question from Cambodia from Dr. Mean Reyatanak Sambat. Do we have impact indicator for eHealth, and how do we integrate eHealth indicators in the health system indicators?
Yes, I think no is probably the short answer. We don't really have a good suite of eHealth impact indicators. And what indicators there are tend to be output indicators. So it could be in terms of coverage of delivery of IT services. I think we are very weak on the outcome indicators, the actual measuring the take-up of services and crediting those that are specifically geared to delivery via IT. So, as I said before, I think this is an area where much more needs to be done. And I think the impetus for doing that will come when people who are managing the healthcare enterprise realise that actually eHealth and ICT is a core business function, and therefore they need to assess how well it's performing and put the resources into assessing how well it's performing in just the same way as they will be looking at the effectiveness of the performance of the manpower that's available, or the estate, or the financial services that are being provided. Now, I think although I say eHealth outcome and output indicators are poor, actually, for many aspects of healthcare, of health systems, I would also say that the level of data and information is poor. So the financial and estate indicators that are available may be many more than the ones concerning IT, but I think very often they're not very balanced. They tend to be very quantitative, and from what I've been saying today, you'll understand that actually really the way forward in this is this balanced scorecard approach, which blends both the quantitative and the qualitative sources of data and information, and also looks to supplement them with really understanding what the view of the end user of the services actually is. And from that point of view, I would say that most health systems are very poor poorly served by the information systems, broadly interpreted, that they have to provide them, i.e. the decision makers, with the balanced scorecards that are really needed. So I'm saying that's true across the board, and it's particularly true within the eHealth ICT sector. And although it is tempting for each of these parts of a health system to set up their own monitoring and evaluation systems, it's far better, really, if there's an integrated approach that enables essentially the same infrastructure of information and intelligence gathering to collate the different types of data, information and knowledge, assemble it in such a way that the wise people who sit at the top of the organisation can take the right sorts of judgments. And so my critique of ICT, I would also apply to the others and urge that the wise managers at the top of complex organisations like healthcare understand that actually investing in information and ICT systems is not only makes sense not only because it enables you to keep on top of the costs of delivering an ICT infrastructure, but it delivers greater value to the organisation because it can be used as the vehicle through which a tremendous amount of the data, information, knowledge that is needed to assess the performance of the rest of the organisation can be assembled. Yeah, thanks, William.
Okay. Thank you on that. We have still 4 questions to answer. We go next to the question of Neranga Prabat. Any accepted criteria to evaluate the integrity of aggregated data, or is it context dependent?
I'm not sure I entirely understand the question, but basically things will be pretty context dependent. But I think there are some international standards for, well, for example, the classification of diseases and the work of the clinical terms that we've discussed, and various other aspects. But in terms of the statistical data that's available about health systems, particularly the IT side, it's very, very sparse. And I know when the World Health Organization were producing booklets that gave a very good insight into the functioning of health systems, it took a huge effort by the central team looking at the data and information that was available from countries to make sure that they were comparing like with like. And that remains a big challenge. I think that there may be international classifications of diseases and conditions and clinical terms, etc., but we're still a long way away from having any agreed international classifications for eHealth outcome measures.
All right, thank you. Yes, it's really a big effort to address this problem on data collection. The integrity of data is really a huge problem across countries, most especially in us, for those who are in the developing countries. But we could surely, we are surely arriving at solutions which will help us improve the way we collect our data. Thanks for that question. We move on to the next from Winmin State. We have 7 minutes to answer the rest of the 4 questions that we still have. From Winmin State, is it safe to say that Six Sigma Sigma is process-oriented? Because it seems to me like implementing Six Sigma in one organization needs strong project management skills and organization, which might have to tackle change management as well. So going back to the question, is it safe to say that Six Sigma is process-oriented?
It's process-oriented. It's process-oriented. Yes, it is. It is. It's a tool of project management, program management, but as I said, the distinguishing feature is that it focuses attention on those projects that need to be undertaken to resolve the things that the customers feel most need to be sorted out. That's the distinguishing thing, and that ought to be a continuing process because you're always wanting to improve the services that your customers, whether they are internal or external, whether they are managers within a health system or they are consumers of the health system, the patients, those customers that will, if their voices are heard, help then define the projects that are required, and that is a continuing process. Continuing process, yeah.
Okay, thank you. Yes, it's a process-oriented tool to resolve customers' needs or patient needs. For our next question from Cambodia, how many IT frameworks are related to risk management, like COVID, COSO, or others? I think he is asking on IT frameworks that are related to risk management.
Well, I think I've covered the major ones that you need to know about. So you've got, yes, COVID, and the other ones that I mentioned for you concerning COSO, and I've referenced you to the ISO standards on risk management. And then in terms of the IT management frameworks, you've got ITIL, ISO. So I think you've got the major ones that you need to be aware of.
All right. Yes, yes. COVID, COSO, and other frameworks were discussed are, as Peter said, are the major ones on IT frameworks on risk management.
And remember that the IT governance document that I pointed you to right at the start of the session was making the point that you need to consider risk management as part of IT governance. So
okay.
The guidance that you get on IT governance should also be covering risk management.
All right. We have to refer back to that slide. So anyway, these slides are available on our HinCheck's website and in our AeHINacademy.org. So you could retrieve that link to that document. Our next question is our next question came from Bangladesh. How do you think about the monitoring and process of ITIL 7-step? Is it working properly? I think he's thinking of he's asking, of your opinion about ITIL step 7 or 7-step. Is it working properly?
Well, you can make ITIL, the 7 steps of ITIL, work well. Yes, absolutely. Because ITIL provides a logical framework for you to work around. So, identifying the strategy, defining what you're going to measure, gathering the data, processing it, analysing the information, presenting and using it, implementing improvements, and then looking to see, well, what do we need to do on reflection to go through the next cycle. So I think the short answer is yes, it should be working properly where it's thoughtfully implemented. It's a framework. It's to enable you to take good decisions, to set up the right systems and processes, really, to answer those questions.
Okay, Thanks on that question from Bangladesh. Another question, second to the last. I think to achieve good outcomes, we have firstly need to validate input and output. While in most of developing countries, a standard for data and format of the same information not even exists. Too many vendors implementation roadmaps but are not united, but do not have a united goal. I think this is one of his reactions to what you have mentioned earlier, most specifically to tools which they can use in aligning their current implementation. Thanks on this response. For our last question, we have from Cambodia. For eHealth, how do we incorporate COVID-5 in the development of national eHealth plan? Or do you know any country experience on using COVID in their actual eHealth strategies?
Okay. I will answer it, but I'm conscious that's the last question. We're coming up to time. I just wanted to give you some of the capacity building resources that I've been mentioning, so that you've got them there if you want to follow up. I wanted just to mention that there's the quiz time that I hope you will ask and answer. And then we've got the trailer for webinar 8. And the reason I wanted to get to this in answer to the question was, oh, sorry, that's right, yeah, Wednesday, is to say that on Wednesday I will answer that question, because I will show how all of these different standards and frameworks that we've been using all kind of pull together when you sort of locate them within the COVID-5 framework. Okay, so I think that's answered that question, and also then concluded the slides that we needed to get through. So I hope that got us to the end on pretty much on time.
All right, I think we're okay on this. Thank you so much for addressing all the questions that we have in our meeting room, and for the monitoring and evaluation stories, documents, and resources which most of or almost all of us here would find very useful, because these are current experiences that would really serve as guidelines and things to consider in our current plan. So I think we're okay on this note. Any other announcements, Peter?
No, but I'd encourage people to attend on Wednesday, because I'll try and pull the different things that we've been talking about over the previous sessions all together, so that it will be a useful conclusion for you.
All right, yes, webinar 8 would help everyone to recap the things that they have learned from session 1 or lesson 1 of this AeHIN Academy. So again, thank you so much. It's already 4:31 p.m. here in the Philippines. Thank you so much for attending our AeHIN Academy lesson 7. Please check your emails for the meeting details for lesson 8 or for webinar 8. And we invite you again to answer the quizzes and access all resources at www.aehinacademy.org. Thank you so much for all the questions, and see you on lesson 8.
Yep.
Thank you.
Thanks. Bye-bye, everybody.